Let's go over the most common signs and symptoms of acute myeloid leukemia. I want to preface this by saying acute myeloid leukemia is extremely rare. That being said, if you do think you have one of these symptoms, talk to your primary care doctor first. It's unlikely, but talk to them first and then you can go from there. The first and most common symptom is some sort of type of bleeding, whether it's bruising, which is bleeding of the capillaries, or venous bleeding, which is through your nose, your gums, when you go to the bathroom, when you poop or you pee. When you have hundreds of thousands of white blood cells in your body flowing through all the pipes, which is your blood vessels, they get clogged up. They don't work properly, and that affects how your platelets function, which stop bleeding. So if your body can't stop bleeding, you naturally start to bleed from your nose and your gums. The last few symptoms that you might experience are directly related to your blood counts. So one, if you're anemic, your hemoglobin levels are low, you'll feel fatigue, you'll feel really tired, you'll be napping all the time. The third most common symptoms are a group of symptoms we call B symptoms. We see them in all types of cancer, but I very commonly see them in my leukemia patients. Those three symptoms are night sweats, and I mean you're soaking your bed, you're soaking your clothes. You need to change your clothes 3 to 4 times a night because you're sweating so much. Night sweats, fevers, you're having uncontrolled fevers, but otherwise you feel fine. You're spiking fevers of 100.4, 101, and there's no source. And the last one is severe weight loss. Now that can happen with acute leukemia, but less so. So I usually look for the night sweats and fevers. The reason weight loss not so much is because acute leukemia, the onset is very quick, days to weeks. It's very sudden. You don't really have the time to lose the weight that you're expecting from other cancers. If I took a sample of all the patients I saw this year alone and how they got diagnosed, one is that they went to the primary care doctor just for a routine visit, they were feeling fine, they did a CBC and they found the leukemic cells and we caught it really early. The second thing is easy bruising or bleeding. If I see that and they got sent to the emergency room to get worked up, we do a CBC and we start seeing these cancerous cells. Now, this is just a reminder, whether you're fortunate enough to catch it early or you had to come to the emergency room with symptoms, that does not change your prognosis. Your entire prognosis is based on the genetics of the cancer. We do next generation sequencing to determine what kind of cancer you have and how we can target it specifically for you.